In the world of cancer treatment, few innovations have sparked as much excitement as CAR T-cell therapy. This groundbreaking approach harnesses the power of a patient's own immune system to fight cancer. The therapy involves removing a patient's T cells, genetically modifying them to produce chimeric antigen receptors, CARs, and infusing them back. These supercharged immune cells can then recognize and attack cancer cells. CAR T-cell therapy has been particularly effective in treating certain types of leukemia and lymphoma. In some cases, it has led to complete remissions in patients who had exhausted all other treatment options. The FDA has approved several CAR T-cell therapies for various blood cancers, marking a significant milestone. Despite challenges like severe side effects and relapse, researchers continue to refine and improve CAR T-cell therapy. While CAR T-cell therapy has revolutionized treatment for certain blood cancers, it's not a perfect solution. One of the biggest challenges is achieving long-term remission for all patients. Many patients who initially respond well to the therapy eventually relapse. Another significant challenge is the manufacturing process for CAR T-cells, which can take several weeks. This wait time can be critical for patients with aggressive cancers. The lengthy production time also increases the cost of the treatment, making it less accessible. Side effects like cytokine release syndrome and neurotoxicity remain a concern. The effectiveness of current CAR T-cell therapies is largely limited to certain types of blood cancers. Despite these challenges, the potential of CAR T-cell therapy continues to inspire scientists and clinicians. Enter the next generation of CAR T-cell therapy, armored CAR T-cells. Developed by Dr. Carl June and his team, this approach enhances the effectiveness and durability of the therapy. The key innovation is the addition of interleukin-18, IL-18, a powerful immune-stimulating molecule. By engineering the CAR T-cells to produce IL-18, researchers have created a more potent and persistent cancer-fighting force. These armored cells can better withstand the hostile tumor environment. One of the most exciting aspects is their potential to overcome resistance in patients who have relapsed. The enhanced persistence of these cells increases the likelihood of achieving long-term remission. This broader applicability could revolutionize cancer treatment across multiple fronts. Section 4. Impressive results from Phase 1 clinical trials. The recent Phase 1 clinical trial results for armored CAR T-cell therapy have sent waves of excitement through the oncology community. The trial, focusing on patients with relapsed or refractory non-Hodgkin lymphoma, has shown remarkable outcomes. The most striking finding is the 80% response rate among these patients. This is particularly impressive given that these individuals had already failed multiple lines of therapy. Many had been told their cancer was untreatable. Early data suggests that many patients are maintaining their responses over time. The armored CAR T-cells appear to be more persistent in the body, continuing to fight cancer cells for extended periods. Despite the enhanced potency, there were no new safety concerns observed. Section 5. The science behind armored CAR T-cells. The key to understanding armored CAR T-cells lies in the role of interleukin-18, IL-18. IL-18 is a naturally occurring protein that plays a crucial role in the immune system. When the armored CAR T-cells are engineered to produce IL-18, they create their own supportive environment. This self-stimulation allows them to remain active and proliferate more effectively. IL-18 also helps recruit and activate other immune cells, creating a more comprehensive anti-tumor response. This broader activation may explain why armored CAR T-cells show promise against a wider range of cancer types. IL-18 has been shown to promote the development of memory T-cells, improving the durability of responses. Section 6. Faster manufacturing. A game-changing advantage. One of the most significant advantages of the new armored CAR T-cell therapy is its reduced manufacturing time. Traditional CAR T-cell production can take up to a month. The new process has cut this time down to just 9 days. This dramatic reduction is a game changer for patients with aggressive cancers. The faster manufacturing process is made possible by innovations in cell culture and genetic modification techniques. This also significantly reduces the cost of manufacturing CAR T cells, making the therapy more accessible. The shorter manufacturing time reduces the risk of contamination or errors. This could lead to fewer cancer treatments and better outcomes overall.